So good afternoon. I'm Karen Merrill, RBH presenter and EAP provider, and I'm here today to present the Lunch and Learn topic for March, which is caring for aging parents. And there are a lot of you out there interested in this topic because we've had lots of people sign up. So I'm hoping that you get what you're hoping for during this training. There's a lot of material to cover, lots of important information, which you'll certainly have access to afterwards. Our kind of the format will be as it usually is. We'll have polling questions interspersed throughout the program, and hopefully we'll have time at the end for questions. If not, you can just email those and we'll respond. I want to share just a little bit about my background since it's relevant to this training. When I first moved to Oregon in the late 90s, I worked for a company called Tualatin Valley Centers. They've since changed their name, and I don't recall what that was, but I did geriatric social work. And I worked in their older adults program. And in my role there, I worked with both older adults and their families to kind of assess what their mental health was like, how they were enjoying their life as they were moving towards later years. And that could have been in a nursing home, their home, a board and care facility, or assisted living. So I have a fair amount of background on this subject. I also dealt with my mother through her later years and then her death. So this is close to my heart, this topic. So I just wanted to share that with you all as we begin. So our agenda for today, I'm going to set kind of a statistical background. We'll be certainly talking about the issues that adult children have caring for either their parents or their relatives, and I'm going to use that kind of interchangeably. I'll be presenting some techniques for raising sensitive issues with our family members, addressing concerns we start to see while respecting their dignity and independence, looking at when it's time to ask for help from the outside yourselves, either other family members or professional services, and then, of course, taking care of your own needs, since elder care providing is very, very difficult work and is enjoyable and rewarding, but also we have to make sure we have self-care in place at the same time. So our screen seems to go to sleep a little bit as I try to advance it. There we go. So just statistically, just to give us a picture of where we're going in our culture. In 1995, 33.5 million people in the US were 65 or older. By 2005, more than 40 million were over 65. And when we project into the future, when all the baby boomers have been kind of dumped into this category of over 65, there's a projection of over 62 million. And even more projections are that of this group, the fastest growing will be over 85, which is typically the group in need of daily care. That will then, of course, tap into family or other resources for help with self-care. So this is a little persnickety today for some reason. Okay, our first polling question right off the bat. In 2014, what percentage do you feel like of elders required assistance with activities of daily living? So actually, although it says select all that apply, I would rather you just pick your best guess. What percentage do you think of folks over 65 were requiring assistance with their daily living? And we'll open up the polls and give you a couple minutes, and then Brenda will tally them up and tell us what the responses are.
Well, thank you, Karen. So I just closed the poll,
Okay.
and we have 41% of participants voting for A, 25%, 35% voting for B, 18% voted for C, 75%, and 5% voted for D, 10%.
Okay, so you may be surprised because what the answer to this is actually B, is 50%. And as I was doing the research, I was surprised that it was that many, but it does kind of tell us what we're dealing with. So it's actually 50% that is requiring assistance. So I'm okay. So as this indicates, 50% of elder population needed assistance with what we call ADLs. That's activities of daily living. Means bathing, walking, transfer, shopping. And this was really surprising to me. Of the 50%, only 5 were in nursing homes. And that actually also includes board and care, or what we call adult foster homes, and assisted living. So family caregivers are assisting the rest of that. And no surprise, the majority are women. 64% work, and 41% care for children at the same time. So we can see what a difficult situation this is for family members. And the National Council on Aging has told us that family caregivers devote an average of a little over 15 hours per week. 50% are required to take some time off to accomplish those tasks. Many go into work late or work fewer hours. 6% gave up their jobs completely to care for their parents or elder relatives, and 3.6 retired early. So this is a big issue in our society today. And things have changed in our culture. You know, long ago, families stayed put. We lived near our parents. Sometimes they lived with us, and it was easier to accomplish the self-care. But now, families are more spread out. They live in different states, both people working, our lifespans have increased, and in certain areas there can be a lack of service and information and referral. It's expensive to provide elder care, so there's economic concern. So, you know, elder folks and their children or family members caring for them, there's emotional and physical responsibilities that become taxing as we do this job. There's even more to have to deal with, what we call, you know, the sandwich generation, those folks that are caught between caring for aging parents as well as raising children that are still at home. So they are pulled between two poles. Very important to keep in mind that even with these statistics, our aging relatives present us with many gifts that come from the wisdom they've acquired, our shared experiences. So it's really important to find ways to partner with our parents that are rewarding to both sides. So as we begin a discussion on the need, exploring the need for assistance and kind of tackling those sensitive issues, I'm going to ask the second polling question. So the following observations indicate a need for a conversation with your elder relative, except forgetting to turn the burners off the stove, repeatedly call you by someone else's name, missing appointments, misplacing keys, and neglecting hygiene. So which of these would alert you to thinking that maybe my parent is going down a path that needs some assistance more than you can provide? So we'll open it up.
Okay, so I just closed polling question 2. We have 36% of participants voting for A, forgetting to turn off the burners on the stove. 42% voting for B, repeatedly calling you by someone else's name. C is 37%, missing appointments. 65% voted for D, misplacing keys, and 40% voted for E, neglecting hygiene.
Okay. So this may surprise you, but misplacing keys is not really a red flag for an indication of dementia or advanced senility. I don't know about you, but I misplace my keys fairly often, or it's so that's more an indication of our plate's too full, and so we were thinking about something else at the time we placed them. The other things are alerts to either some dementia, depression, cognitive decline. So I threw that in just for that, kind of that very example. So just so you know, I'm trying to advance the slides. It's just, okay, there we go. So now we're going to talk about kind of these discussions, beginning to notice changes that would want you to bring this into discussion with your relatives. So what's very important to keep in mind is involving your relative in this process. There is, so much loss involved in aging and giving up independence. So you want to communicate them in a way that honors them and enlists them in recognizing what's happening, so that as you move forward, you've set some groundwork in that way. So being alert and mindful of changes you might see, and then asking questions, either on the phone or in person. Is something bothering you? Is there something that you might want to talk about? You kind of mirror what you've seen or heard in terms of their reactions, and then move it forward and engage them in a care plan whenever possible. If they do recognize that there is a problem, then query a little more about what have you done so far, what can you do, what options you may have, what do you think their next step is. You're really trying to shape their thinking so that they're engaged in this process. Where can you get information, and who can help you as you move forward? Communication is absolutely key. Giving your full attention when your parent or relative responds. And silence can be a powerful tool. So you're kind of giving them permission and giving them a few moments to come forward with things that may concern them. If you're seen as a good listener in the beginning of this process, they're more likely to share important information as you move along. And it's going to foster trust. And I can tell you firsthand, and you probably know this, it's a lot more effective than telling them what to do. So remembering the importance for communication. If, as you talk to them, their answers seem impractical, ask further questions. How do you plan to accomplish what you want? If your plan doesn't work, what else will you do? How might you see your family helping you? And sometimes, despite our very good intention, our parent may not welcome inquiries about existing or future elder care issues. It can be frightening. It's the beginning of a path that's hard to go back from. And it's part of the aging process. So if that were true, if you don't seem to be the appropriate person to do the communication, then change places with someone who has more influence. Is it another family member? Is it a friend or neighbor, a doctor or a spiritual advisor, or expertise from an elder care agency? But knowing that there may be other ways of looking at this that can give more effective results. So if you feel like, or even, want an assessment around whether or not it's time to bring some help inside the house with these ADLs, or activities of daily living. It's not an easy decision. It's not an easy discussion, but sometimes it's necessary, and it can be helpful in terms of safety risk and other things. So the first step is to think about what services you need. Do you need help with meals, or do you need help with transfer, or taking to doctors, or really some mobility issues around getting from the bed to the chair and those kinds of things. So define what it is you need. Think about how you'll advertise if you're taking this on yourself. Have you heard of others that do this work independently that have a good reference and good reputation? Will you put notices on Craigslist or on community bulletin boards? So think about how you'll advertise. On the first contact that you have with these people, generally over the phone, give a description, what the schedule would look like, what your expectations are, what you'd want them to do, what you're willing to pay. Grant an interview, have somebody come to the house only to very serious candidates. You don't want to waste your time, their time. Arrange someone else to be present and provide feedback and support for you, and always check references and even consider doing a background check, because remember, this is your parent or your relative and you're having them in your home. So in an interview, kind of get a sense of what they're like, what makes them interested in this kind of work, what their last position was like, what their training's been like, what outside just the care with your parent are they willing to do? Would they do some cooking and light housekeeping? And a really good question, I think, what would you do in case of an emergency? Another one that isn't listed is, will you have other clients at the same time? And what is your flexibility? Are good things to keep in mind. So our third polling question: which of the following is not an advantage of using an agency to care for your relative over hiring one yourself? Employees are generally bonded. Agency does background checks. The rates are more responsible or more reasonable. If the worker can't make it, another caregiver is available, and the agency provides training. And rather than select all that apply, select the one that doesn't apply. And so we're going to open it up and let you see what you think about this one.
Okay, so it looks like our responses are in.
Okay.
We have 11% voting for A, employees are generally bonded. 4% voting for B, agency does background checks. 73% voted for C, rates are more responsible. And 11% voting for D, if workers can't make it, another caregiver is available. And just 5% voted for E, agency provides training.
Okay, so you're on the same page that I'm on. When you use an agency to provide this work, the rates are more because you're paying for them doing the legwork, doing the training. They're on the hook. When you've hired yourself, then actually you are more. You hold the responsibility. But for example, just briefly, when my mother was aging and needed help, I lived out of state. My sister lived closer, but still not in the same town. And so we used an agency that had been recommended to us. We interviewed a couple of them, but we felt like it was worth it to have that agency cover all the liability. So, but you do pay for it. There's a cost to that. But it's important information, I think, to know going into these things. And sometimes word of mouth will tell you somebody good independently. So that's good to keep in mind as well. So we're going to move forward. So now let's look at the setting that you've selected an agency. So you're going to interview them and you're going to ask about their accreditation, who's licensed them, how long they've been in business, did they take Medicare, did they accept sliding scale. You want anything that you can think of that would help you feel more comfortable. What are their fee for services? What's the screening process? Is there ongoing training throughout, the year? Do they provide that? And what are the credentials? Oftentimes they employ CNAs, if I'm not mistaken. So, kind of what is the credentialing and what's their training like? So it may seem soon, but I felt like this was an important question. Which of the following most approximates your concern about your parents? Needing more care at home? Thinking that they really need to move to a facility? Thinking about them needing to move in with you? Needing to coordinate care from out of state? And being in that, kind of sandwich generation where you're needing to care for both your children at home and your parents. So this will kind of give us a sense of what you're dealing with.
Okay, so our responses for polling question 4 are in. We have 50% of participants voting for A, needing more care at home.
Okay.
26% voting for B, needing to move to a facility. 16% voted for C, needing to move in with you, and 26% voted for D, needing to coordinate care from outside of the state. And just 12% voted for E, needing to care for parents and children.
Okay. Okay. So it sounds like we're all over the map, but mostly considering needing more care at home. Okay. Well, that's good to know. Good for me to know. Okay, so now we're going to be moving into the section on taking care of you. I alluded in the beginning to the fact that this is hard work. This is work that's oftentimes on top of many other commitments, and we can get overwhelmed and feel pulled and feel guilty and feel all kinds of things. So it's important to know that we have to take care of ourselves and we need respite care. So according to the Children of Aging Parents organization, we're providing the majority of the care. We're doing it without pay, often with little or no help, while coping with these other things. And then, as some of you indicated, it's compounded when we live at a distance and we have those concerns where we can't be on the ground. So this can be very rewarding work as well. I mean, as we're actually moving through our parents' end-of-life stages, it can be very rewarding. But it can also become frustrating if we don't ask or accept help from others, and we can get angry and feel frustrated and all kinds of things. So we're going to be airing some issues to kind of put those things at the forefront so they're not overlooked. So as we talk about this, taking an honest look at ourselves to monitor our stress level. Do we resent having to do this job? Do we resent other family members for not pitching in as much? And I think what's very key here is what our relationship looked like before. You know, we don't all have, model relationships with our parents coming up. And maybe we may be the logical choice to be providing this care, but maybe we weren't, our parents' favorite, or maybe there's unresolved conflict in that relationship. That's going to make this hard without some resolution. Maybe this isn't satisfying to us. It feels more like a burden on top of everything else we do. And are we feeling like the family's chipping in? I mentioned kind of before that we can have thoughts of shame, inadequacy, hopelessness. It's hard. It's not easy. So bringing it out, though, and addressing these issues helps from it bleeding over into the work that you're doing and in the relationship that you have with your parent or your relative. Whoops, I think I skipped one more. I did. So let's see if I can back this up. Yeah. All right. So more questions. Is it affecting our job? Are we missing work? Is it affecting our marriage? Is it affecting our relationship with our children? Is our anger causing us to raise our voice or using forms of physical restraint? How are we coping? How are we what we call sometimes, self-medicating? Are we lacking an appetite? Are we eating junk food? Are we overeating? Are we drinking one more glass of wine than we should? Not exercise, not laughing, having effects of our sleep, and developing physical symptoms. When our immune system is taxed, then we can become sicker easier. So Are these things grating on you in that kind of way? So taking care of you, overall self-care, and we talk about these things kind of in every webinar we do, just to keep us aware that being mindful of our care will help us in anything else we do. Practicing some relaxation at night before we go to bed, whether that's progressive muscle relaxation, whether it's a meditation or some self-affirmations that you've chosen, visualization, taking yourself to your most peaceful, restful place. For me, that's a place on the ocean where I hear the waves and see the waves in my mind's eye. Practicing gratefulness, we talk a lot about how if we're reminded first thing in the morning, last thing at night, of the things we're grateful for, we're happier, more content people. Nothing beats exercise for bleeding off stress and raising, serotonin, the feel-good chemical in our brain. And I'm fully aware that it's a choice of how we use our time. But if we can exercise at least 25 minutes a day, 3 times a week, we're more grounded and more balanced. Eating healthy meals, drinking plenty of water, flushing our system, trying to be in the moment, staying in the moment as we worry about other things, and being aware of our breathing. And when we're under stress, when that breathing starts coming from our upper chest rather than belly breathing. And the EAP is really tailor-made for you if you're dealing with frustration and stress and issues around elder care issues, to talk to a counselor about it. It's that's what it's there for. This is a really good tool to use when you're overwhelmed by these needs. So create relief. There are organizations and people that are out there. Number one, and we'll talk a lot about bringing the family in, but recruiting family, friends, neighbors, volunteers, letting your needs be known. Counties oftentimes have what's called area agencies on aging that have services that you can avail yourself of. And in terms of the workplace, elder care is fast replacing child care as a #1 dependent care workplace issue. So you learned about this workshop today, and maybe there's some flex time options for you to be able to deal with this demand. Support groups are extremely helpful because you're sitting in a room with people that speak the same language you do. They're experiencing the same issues and needs. So some provide education about illnesses, other emotional support. But you can locate those. Oftentimes, hospital discharge planners have that information, or, I Google everything. So an internet search can reach that too. And then there's specific illness associations that deal with cancer, diabetes, dementia, Alzheimer's, that have programs for family members as well as patients. So, next polling question. More often than not, one sibling has a greater role in elder care responsibilities than others. True or false?
Oh, wow. So we have 99% of participants voting for true, 1% voting for false.
Yeah, well, that's it. It oftentimes falls on one sibling over the other, and as soon as this slide advances, we'll see We'll talk more about that. Okay, so what we're going to start talking about is how bringing the family and caring for yourself, bringing the family into the mix for help, and insisting on family meetings and telephone conversations. So regularly scheduled family meetings and telephone conversations is a practical way to address issues and delegate responsibility. Now, not without issues. When our elder's an aging parent, oftentimes a family problem arises when one child, and most often a daughter, becomes the primary caregiver. And there's resentment that can set in. And guess what? These, bring, like we talked about what the relationship was like growing up with our parent, these bring up old sibling rivalry kinds of issues that get to be played out during this time. So it's more things that need to be addressed. And there are a variety of issues, reasons why siblings do not share in elder care. Sometimes it's the parent, right, that drives that they want one person to care for them, and they have one that they single out. Sometimes we take on the job when we're just not assertive enough to ask, or we don't want to deal with the conflict in asking. There can be a denial by one sister or brother of what's happening. They don't want to face the writing on the wall, and so they ignore it. Siblings may find it difficult because they live out of state, and frankly, out of state is out of mind. So that can be the case. And others may feel overburdened by what they're dealing with right in front of their own family. Some siblings provide financial assistance and feel like that's enough. And I just love this one, I'm sure you do too, that a male sibling may believe that it's woman's work, and they're not willing to help. But bridging this care gap, bringing assistance in, is largely dependent on our willingness to ask for it. So it's really behooves us to press other family members to help us out. So let's look at what a family meeting would look like. And, if you have the advantage of doing it face-to-face, great. If there are people that maybe get them on the phone, or if it has to be a conference call, but employing clear, concise, direct communication. Set a time, don't let it go on. Set it like you would a meeting with an end time, and limit the agenda to a few important topics at one time. Try to give each family member equal time, and although there may not be agreement, allow each the right to their opinion. It's so important to feel heard, as it is for your parent or your relative. Focus on the present actions the family member can take. Not, I do all this and you do nothing, and try to stay right there in the present with how you move forward. Resist the temptation to bring up, family laundry, family history. It won't be helpful. And be as specific as you can. I need your help, and this is what I need. It empowers you, and it also lets them know what exactly they're being asked of. So kind of another thing to keep in mind, as we observe our senior relative or parent going through this stage, there can be some telltale signs of mental and physical decline when you need to bring in assistance of another kind. So, a decrease in interest in other people, interest in usual activities. Sometimes, if your parent is one that has a number of different doctors and they're all prescribing medication and there's not one central oversight, there can be some competing side effects. So sometimes, if you can get one person to kind of review what the medication list looks like, you can eliminate some symptoms by altering some of the medication. Sometimes there are, depression is setting in and other issues that require specialized counseling. We get more self-centered as we get older, so it needs to be addressed, and this would be done with your parent's doctor as the oversight. But something I wanted to mention as we address these issues. So what we're also wanting to do, and kind of to just put it out on the table as we move forward towards end of life, is we're wanting to add life to those years, and not necessarily just tick off the calendar. But it's very common for our parent to be stifled with lots of fears, fear of their death, fear of dependence and disability, fear of not being needed or useful, feel of losing their mental agility. There's so much information we read about people with Alzheimer's and scary things that we become aware of. Fearing independence, fearing outliving their money is a common fear. And then, of course, isolation, loneliness, and sorrow. So knowing that, and then as we have built kind of some open communication, hopefully, to be able to talk about it. So, aging's a normal process. We actually, as we age, have less distractions than we had when we were young, in terms of what am I going to be when I grow up? And you may think that at 30, or raising your children, or these things. So, but we can get stuck. So if we get stuck, then these questions can be helpful in a loving kind of way. What interests you? How could we get more information on things that interest you? What would you like to do right now? What kinds of friendships can you nurture or create? The other thing about end of life is we lose a lot of friends. And so how do we deal with that without feeling isolated? Is there something you'd still like to learn? And how would that happen? Depending on a level of mobility, would you like to volunteer or teach? Or is there someone that you could visit and brighten their day? Nothing helps us feel better than really reaching out to others. Any unfulfilled dreams you'd like to talk about or try to pursue in one way? And do you feel, I think that oftentimes at end of life, people can feel regrets. So have you kept your promises? Are there things you want to repair? Have you restored strained relationships? Are there people you'd like to reach out to and contact and reconnect with? So not an easy conversation for us or for our parent, but the more we've been afraid in our culture to talk about death and deal with these things. So the more we can do that, the better we're going to be, and the better we'll feel as we go through this together with our parent. So here's our last polling question. So confronting end of life issues with our relative actually makes us think of our own lives. And I'd rather you just vote for one if you'd vote for true or false.
Okay, I'm just going to close the last polling question here. And we have 98% voting for true, and that leaves 3% voting for false.
Yeah, absolutely. As we deal with these issues with our parent, it makes us think of our own life and where we are and what we might want to do. And also, I think that when our parent dies, particularly if it's the second parent, we're on the front line. So there's mortality issues here. And it's just part of life. So raising these are important to do now. So points to consider as we start to close our program today. Above all and before all, learn to listen. Pay attention to what our parent is saying as well as they're not. Try to understand their feelings. Asterisk mark, be careful how you give advice. It's so important that they make as many of their own decisions as they can. So helping them preserve their dignity and whatever independence they can, as long as they can, is helpful. If you get stuck, when communication seems to kind of get stuck in a rut, try changing your own reaction. Do something different. While we can't change our parents' behavior, sometimes a small change on our part can lead to a positive shift. Use I messages when confronting your parents or anyone else. I'm sure you've heard this before. Remember that oftentimes older people are touch deprived. So touch is an effective way of conveying affection and giving comfort. Try to keep a sense of humor. If you can find humor, find things to laugh at with your parent, it'll make any situation better. It will release tension for you and for your parent. A way to do this sometimes is to reminisce about pleasant past shared experiences. You're not focusing on the losses of today. You're kind of reviewing the good times you've had together. There are lots of things where you may not agree, but respecting each other's opinion is important. And if you can ask for their advice or get their consultation about what's going on with you or your own family, will make their day. I mean, it's a way of making them feel a part of their lives. So more resources from the EAP. We have online resources at Personal Advantage, myrbh.com, and also adult and elder care services where a specialist can actually assist in the area where your parent is, looking for services including transportation, meal delivery, exercise activities, all kinds of things that can kind of, set a path where even before you think about bringing somebody in the house. So the EAP provides a lot of rich resources that can help you with this. Here's some publications that you might want to take a look at. It might just help as you travel this terrain. Again, you'll have access to this PowerPoint if you want to use any of this information for reference. There's also a really good handout attached that I would encourage you to take a look at. And so we've covered a lot of material, as I've said. I'm hoping that you have found this worth your time and useful. And we have a few minutes to open up for questions. So fire away if there's anything that you'd like me to answer for you.
Okay, Karen, it looks like we have a couple of questions that have come in. So the first one is, what age band are you classifying as an elder or aging parent?
Yeah. Well, you know, seniors are, as we looked at the statistics, seniors are actually 60, you know, the category is 65 and over. Now, you know, we know that the 65 of today is not the 65 of, you know, yesteryear. So, and I don't, unless there's some specific illnesses, I don't think you see decline. I think it can vary by illness, particularly if there's early onset dementia. But I think generally when we start seeing these issues are late 70s and into the 80s and beyond, when you know, we start losing some of those functions. It's a good question. Anything else?
Yes. Does the EAP cover us in other states?
I believe so. Anywhere. Now, I'm going to ask a little more about that. Are you thinking about family members or services in that state? The EAP is good for anybody in your household or dependent relatives. So if you could be a little more specific, I could probably do a better job of answering. And maybe should we take a next question while we get more information there, or is there any other question?
Yeah, I think that's a good idea. We have quite a few questions, so okay. I'm just going to move on to the next one.
Okay.
How do you encourage your parents to develop an action plan for when their needs change as they age?
So I would sit down with them and have a candid conversation about the future. And if you can begin the conversation by maybe sharing a story of a friend of yours and their parent, or something that sets a stage to normalize it. And even, you know, even some questions about, have you thought about this? And have you thought about how your own parents, like your grandparents, your parents handled their stages of aging? And what did you think about that? I mean, because sometimes I think that's a frame of reference, is that they'll remember when my mother did it this way or my father did it that way. So it's a way of opening up the conversation, but you're absolutely right in that if you can start opening that door when they're, you know, as vibrant and present, it's a good thing to do. It's a great question. What else?
The next question, are we legally required to take care of our elderly parents?
That's not a question that I'm just going to have to surmise an answer. What I believe is no, but I'm not an attorney. So I don't know. I don't know unequivocally that it's no, but I don't think so. I would Google that, you know, or, you know, you have a legal consultation with the EAP too, and you could even, you know, ask them that. So I think we probably have time for one or two more questions. I am going to say we're going to need to close at 1, but I am totally happy for questions to be funneled through Brenda and then me to respond with answers. Any more?
Yeah, the next question is, do you include the persons requiring care in the family meetings? Is it disease decline dependent?
It depends on their level. If they're disease declined that affects cognition, I would say no. If they're if that's not true, then I would, or I'd try it, or I'd ask, maybe have the first one with just the siblings, or tell your parent that this is what you're going to do, that you're going to be having a family meeting to talk about. Elder people, as they get, can get suspicious too. So you want to be as transparent as you can. And I would say the answer to that is you take it. I would take it on a case-by-case basis and use your judgment.
Okay, thank you, Karen. Do we have time for one more?
I'd try one more, yeah.
Okay, so would you please discuss ways to address removing vehicle and driving privileges from a parent?
I am glad to do this. So here's what I would do. I would enlist their medical team. And see if you can get their doctor or one of the care, their medical care team to, at the next visit that you have with them, to discuss this issue and see if you can enlist them in making that judgment that it's time for them to stop driving. It's a very common issue. And it can also be like the last vestige of independence. I remember with my mother wanted her car in the garage, whether she drove it or not. So we kept the car there, but she didn't have access to the keys. And what we did on occasion is that her caregiver, when they would go to the doctor, would drive her car, would drive my mother's car, and it made her feel better. But we had her doctor recommend that she not drive. And then, there's a point where their license expires too. So, and sometimes, it's early on, they will be stubborn about it. And it's just a question of having an open discussion about the safety issues around what would happen if there was an accident. Okay, it's 1 o'clock, and are there many more, Brenda?
Yeah, we have a few more questions, it looks like. Yeah.
Okay. So if it's okay, because I know many of you are needing to drop off anyway to get back to work, if you would send those questions to Brenda or through the channels, I'm happy to respond to them. If not today, certainly by the end of tomorrow. So thank you so much for taking your time today. And the fact that you're asking questions tells me that you've been engaged, and that pleases me. So have a good rest of your day, and I'll respond to any questions that come in.